That is actually an intriguing question. Since hypophosphatasia is a genetic disease, this would actually mean that we had to correct the genetic defect in each individual cell of an affected individual. I'm not sure if we will get there in the next years. I would rather consider this maybe a vision for the future. But still, what we achieved over the last 2 decades is still some progress in treating hypophosphatasia and treating affected individuals. So with the advent of enzyme replacement therapy that could be attached to hydroxyapatite to yield a sustained alkaline phosphatase activity within the human body, surely there is a tremendous benefit and improvement as compared to former times when there was no real treatment actually, and only symptomatic measures could be accomplished for these patients. So survival has dramatically improved, specifically for the most severely affected children. And the fortunate development is that time doesn't stand still, so there's further progress, there are further developments in treating hypophosphatasia. So the enzyme that we're having now is developed further to improve patient convenience, to improve the half-life, so to reduce the injection burden for the patients, to improve the efficacy of the treatment, and also other treatments are making their way. And this, coming back to your initial question actually, includes approaches to bring in correct genetic variants to have sustained ALP activity in the body over weeks, over months, and maybe over years without further injections, further treatments, further manipulations. So what is currently being developed is, on the one hand, very convenient treatment modalities with other injectable enzyme replacements or oral treatments to lower the burden of substrates and thus correct the clinical manifestations and improve and alleviate the clinical manifestations. But there are also treatment approaches that rely on autologous, genetically engineered cell transfer methods to have a sustained activity in the bone marrow, producing consistently alkaline and constitutively alkaline phosphatase to almost normalize a physiological phosphatase activity. And the last step and the most advanced step that's getting closest to correcting and curing hypophosphatasia is surely gene therapy, which has been applied successfully in animal models, specifically in mice, and also in non-human primates. And it has been proven to be safe and effective. And all these developments are at the doorstep to clinical studies in humans.